Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we use for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device. Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services. Or, if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, check for a brachial pulse immediately. If you do not detect a pulse, perform 2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds, which is about 20 to 30 breaths per minute. To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, press your index and middle fingers gently against the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the breastbone. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to depress the breastbone.
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at least 100 to 120 compressions per minute. After each compression, allow the chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So, let's get into position to practice compressions.